My Bonnie lies over the ocean.
Today is July 20th, 2007. It is 3 days prior to Mom's 90th birthday.
My Bonnie lies over the sea.
I was blessed with wonderful parents.
My Bonnie lies over the ocean.
And in those years, we didn't have any worries at all.
Oh, bring back my Bonnie to me.
I grew up in Waukesha, Wisconsin. It's a medium-sized town in southeast Wisconsin. Great city to grow up in. It's big sports culture, and my life as a child revolved around sports. You know, when I was a kid and growing up, I didn't really recognize that my grandmother was suffering from dementia, or really anybody that I knew was suffering from dementia, until probably I left for Boston, that I started recognizing. I was in Montana and left for Boston, and I started recognizing my grandmother starting to have some problems that were, now in retrospect, not really indicative of normal aging.
I got this call asking me if I would consider coming back to the hospital. I grew to love them, the nurses, and the personnel. And they were very good to me.
So my grandmother, Jean Sealing, she was just an amazing person. She knew everybody, treated everybody the same.
Jean was my Sunday school teacher when I was 15 years old at the First Presbyterian Church here in Waukesha. She was a good teacher and a good, I think, a good influence on we girls.
She was starting to misremember some things in a very subtle way. She was starting to forget people's names or not remember the last time I called. I called my grandma every Saturday morning and talked to her for about an hour. She was experiencing some difficulties that were the beginning signs of, for us, of a dementia process.
Dementia is an insidious disease that gradually and subtly steals a lifetime of memories, our personalities, our ability to live independently, and eventually our lives. It describes a set of symptoms such as forgetfulness, confusion, and disorientation, which occur when the brain cells are damaged by disease or a series of strokes.
Dementia is not an aging disease, so it's not a natural process of aging. However, it is most common. It's the most common disease among the aging population. One reason, in my opinion, that it is viewed differently is because there's so much that's not known about dementia.
What is dementia?
I don't know. I never heard of the disease before.
Dementia, I heard of it, but I really don't know what it is.
Dementia is when their mind is walking through their life experiences.
What is dementia?
Honestly, I'm actually not sure.
I don't know. It's kind of like senility, more or less, but it's just a different name.
I really don't know. It seems like a little bit like Alzheimer's.
Dementia is memory loss, is from what I understand.
What is dementia? Have you heard of it?
Well, actually, I have heard about it, but I don't know a lot about it.
Dementia, I'm not exactly sure.
What is dementia?
I believe is when a person ages, and some people may have it, some may not.
Dementia is basically the accelerated aging of the brain, when the brain ages faster than the body does. What happens is the brain shrinks. It, in all forms of dementia, it starts shriveling on itself, and it shrinks at an accelerated rate than it would normally shrink with normal aging.
Hey, Dr. D.
Hey, good morning. How you doing?
Good. On my way out.
Are you okay? Okay. I just want to discuss timeline today because it's going to be kind of a really crazy day.
Like, where are you going to be at?
I'm going to be in the West Valley doing presentations. It's kind of a normal day for me. I guess it's Friday, and I got 2 presentations that are due that I'm going to give. One to Banner Alzheimer's, which is a pretty big place that studies Alzheimer's and prevention of dementia, and that's going to be in an hour essentially. And then I have a presentation right after that at Sun Health. So my daily quest every day is to really establish awareness and education surrounding this disorder. So when I give talks or I work with people, it's really just getting people to understand that dementia is a disease, just like any other disease. So it's really just getting people to change their behavior through awareness and education surrounding this disorder. And it's extremely emotional because my grandmother developed dementia later in her life, and she was somebody extremely important to me. She helped raise me and was a huge figure in my life. So the development of dementia is a very, very significant piece for me. So this is going to be a general talk on, well, a talk about dementia in our program, but it's more specifically on this idea of cognitive, doing cognitive activities for dementia prevention and intervention. So doing this idea of doing cognitive prevention and intervention activities is actually a fairly new and novel idea. So it's a big deal. All right. All right, thanks, dude. We'll see you next one.
Grandmother had a big Thanksgiving dinner, and we were helping her, and Mother took the turkey out of the oven, and the turkey fell from the pan, fell on the floor. So, of course, we kept our mouths shut and served the turkey, and everybody thought it was the best turkey they had ever had.
It was good. I mean, there's some people that are resistant to this idea, the idea of cognitive intervention. People are resistant to for a multitude of reasons. You know, a huge drug influence in this particular area, and not to say that that's bad, it's just that these drugs, you know, there's big pharma involved. So the problem is that the drug, the brain, it's not that drugs are necessarily bad, it's just that the brain adapts to them too quickly, and then it will stop producing it, like Prozac. Now we're going to a talk. We're at Sun Health Research Institute, just a general talk for the average population. And there'll be some great questions. There'll be primarily some older people. It'll be less academic and more just general information. And this idea that dementia can in part be prevented. That's the main message, right? Dementia in part can be prevented. And that's what I'm going. I'm Dr. John DenBoer, and I'm going to talk to you a little bit about this idea of dementia prevention. So this talk and everything I do in my professional life is really dedicated to her and her memory. Her name is Jean Sealing. She was living in assisted living, not unlike this. And I said, why don't you join that coffee group, because they're discussing current issues. And the goal is to keep your brain active. And she said, in a very nice way, she's a very nice lady, she said, honey, I'm not like those people. Yeah. And I said, well, I understand what you're saying, but that's kind of the point, right? Is that we don't want to get to that point. And so a couple years went by, and she progressively got worse. And then there was a point at which she stopped really remembering who I was. And it was, very sad. And I said, Grandma, this is the time right now that we have to start doing something. You can take medication, do whatever you want. And she said, honey, I'm just too old. I'm just too old. Now that interaction I found in the tens of thousands of patients that I've been working with is pretty similar to almost every single person's interaction in this area. And I noticed that this problem was happening to many, many other people throughout the United States and the world, almost everybody that I talked to. So eventually I got my training in the area of clinical neuropsychology, or the study of the brain and how it affects behavior. And as I went along in my postdoctoral training, I found that I gravitated to working with older people. So now, for the last really 10 years, what I've been doing is working on the early identification and the early prevention and intervention of dementia. So when we look here at the brain tissue, this is a brain of normal size. But what happens in dementia is that the brain cortex can shrink to about 1/3 this size. And if you look in here, these areas, these regions in this area are responsible for memory consolidation in this particular region. Right. This is the brainstem coming up from the spinal cord. And then you have everything in here which is responsible in the temporal lobe, which is responsible for the hippocampus, memory consolidation, and memory formation. So that's this area where your thought is. Yeah. So this area shrinks at a disproportionate rate in comparison to the rest of the brain in the cases of Alzheimer's or any other form of dementia.
There are different forms of dementia, as I mentioned, the most common being Alzheimer's, 60 to 80% of it, and Lewy body dementia and vascular dementia is actually the second most common.
I was blessed with wonderful parents, singing and playing the piano, and in those years we didn't have any worries at all.
It was several years ago. It's probably been about 30 years ago. The problem I have is that between the voice and the tremors, the hands, they tell me that it's very close together in the brain, and I can have one or the other, basically, but I can't do both. It really makes it great. I've been having issues with being able to write and to express myself. Memory wasn't affected that much.
The silver tsunami metaphor has been used in popular media and in scholarly literature to refer to the late 20th century demographic phenomenon of extreme population aging, particularly among the elderly. It specifically refers to the enormous baby boomer generation aging Specifically, those over age 60 and over are expected to double by 2050 and triple by 2100. As workers get older and reach retirement age, fewer young people are around to replace them, which means less taxpayers for our medical systems, which in the United States is Medicare. In the U.S., the number of dementia patients are expected to bankrupt Medicare if the disease is left unabated. World population is steadily rising, with a population of 9.6 billion expected in 2050. Notably, this increase is not caused by fertility growth, but by a significant increase in life expectancy, which, incidentally, is a main factor in the increase in dementia prevalence and severity.
I've been a person that's been pretty independent, and so it's kind of a change for me that I have to become dependent on others for normal little things. Well, I just noticed the change in my memory, of remembering things that used to be there waiting for me. I didn't have to search for the answer. I used to know it takes me longer to retrieve the answer. I can see my memory changing and things that I should have known, where I put something or that kind of thing.
Mother made doll clothes, and she loved arts and crafts. She also was a good piano player. She would sing with us and play games with us and read with us.
Hey, bud.
Hey, how are you?
Good to see you, man.
Good to see you.
How's it going? Hey, I was telling you about the AIC.
Congratulations, by the way.
I know, right? Getting people, my patients, my elderly patients, to utilize that technology. Yeah. Because a lot of them are separate from their caregivers. Like their family members are other places, or their caregivers are not, only the ones that have money are their caregivers intricately tied to them. Yep. So it's a situation in which we got to make sure that they utilize that technology. One of the things we're struggling with after this AIC competition is to understand that we can parlay this money into these additional funds. And so we're really at the point now where we're recognizing that this 250 is going to take us only so far, and then we're going to really increase to needing some larger funds from there. Yeah. So yeah, it's a struggle, but you know all about that.
Yeah, it is a struggle. But it's a lot of fun.
Yeah.
Going out and raising money, talking to people, explaining what you do.
Right.
And you'll find a lot of people that are very interested.
Yeah.
Because you guys have a good thing.
Long day, really productive day, a lot of different things had happened. Almost seems like it's 2 or 3 days in one. Had a lot of really good talks and met a lot of really cool people today. So kind of an average day in the whole SMART program at this point. So just really grateful to everybody that's been helping, and that's been really just helping our cause along. And tired, excited, ready for the whole tattoo experience tomorrow, and just can't believe it's all happening. So basically what I want to do is get just because this program, this anti-dementia program that we started is really a testament to my grandmother and my relationship with her. I wanted to get this tattoo for a long time of my grandma, her development from when she was younger to when she was older, the meaning that she has to me in my life. The reason I'm getting this tattoo is to really immortalize the memory of my grandmother, and to have her with me always in a permanent basis to draw from and to get inspiration from. And tattoos are, as you know, are a great way to do that. It's something, a permanent reminder of what motivates you, and the spirit of what motivates you personally and professionally. So Josh really came up with this concept that I thought was awesome, just incorporating 3 concepts that are really near and dear to this program. And one is my grandma, obviously, and the picture of my grandma and I. 2 is the church that I grew up in, First Presbyterian Church in Waukesha, and my grandma's church, my church. And the 3rd thing being the brain, and having the brain be such a powerful
synergy of all these things, my life experiences and my professional mission.
I went to secretarial school to Miss Brown's, and after a short 2 or 3 months, which wasn't long enough, I got a job with the superintendent of Borden's, and his name was Mr. Roebling.
This is dedicated to my grandmother. Everything we do, everything I do is in memory of her. My grandmother raised me for a good period of my life. She was really influential. I grew up in a small town called Waukesha, Wisconsin, not so small anymore. Arizona is projected to have a 44 to 72% increase in the next 10 years. Just by numbers alone represents the world's greatest healthcare crisis. And what I like to tell people is the message here is way, way more important than any product.
All I know is everybody tells me that's what my problem is. Constantly. He tells me that constantly.
What I'm concerned about when families are first diagnosed with a family member who has Alzheimer's, it's a very confusing time on what to do. Yes, your doctor tells you, yes, there has been a x-ray or to tell you what's wrong, but you need to have some type of ombudsman, either through a private individual who hires on to take care of families, to direct them, because as a family member, I've gone through this after my husband got a diagnosis for 2 years with, how do I do? What do I help him with? Yes, I knew the Alzheimer's had programs and stuff, but I think it would be very helpful for an actual person that has training in how to help Alzheimer's families, lead them to the right program that could help delay this process. I don't, before my husband had a diagnosis, I mean, it was a form of madness, and that's a carryover from years and years ago. Dementia also implies, from years ago, hardening of the arteries. I understand that there's been an awful lot of research and awareness raised, which is really, really important for people to understand the aging process, that you can do things to prevent it.
As far as slowing it down, or there are certain steps that each individual can take to reduce the risk. There's no way to prevent it, absolutely, but there are ways we can slow down the progress, can slow down the progress, and therefore risk reduction behaviors that each individual can take. As again, Dr. Daniel Amen, a colleague of mine who's been researching the brain, says the 5 F's: faith, food, fitness, and friendship, and focus. So if we can keep our physical body fit, our brain fit, and make sure that we have the social connectedness, those steps will reduce the risk.
Dementia is certainly an international pandemic level disease. And if you take the other 9 pandemic level diseases and you combine them, they do not even approach the financial and the medical costs, not even to take into account the psychological costs of dementia. So dementia far supersedes things that we hear more about in society, like heart disease or cancer. Dementia far supersedes that. And I think one of the major problems is people don't view dementia as a disease that's like cancer. They almost view dementia as a disease that we inevitably get as we get old. There are more than 5 million people living with dementia in the United States alone. There are more than 47.5 million people worldwide, and that number is expected to grow 3 times in the next 10 to 15 years. Dementia is the 6th leading cause of death in the United States, according to the Alzheimer's Association. Every 65 seconds, someone in the U.S. develops the disease, and every 3 seconds, someone develops the disease worldwide. It kills more than breast cancer and prostate cancer combined. We need to do something. Hey guys, getting ready to go to Shanghai. First flight to Los Angeles. Gonna be awesome. Gonna have an awesome time, and just looking forward to it. Dementia disproportionately affects the Chinese population, with the dementia population in China being the highest in the world. In fact, China has 20% of the world's dementia population. There has been a long history of research and medical practice in the area of dementia in China, mostly involving traditional Chinese medicine. Significant progress has been made on the medical and pharmacy side, although TCM approaches continue to be used. Life expectancy in China has risen dramatically. In 1960, life expectancy was 45. In 2016, it was 77. While 1 in 6 persons are now over the age of 60, in 2025, 1 in 4 will be. It has been estimated that the Chinese elderly population will reach 30.4% of the total population in 2050, which will include 100 million elderly people over the age of 80 years old. I am the only Western person that I've seen in the last 24 hours. China is running out of time. President Jinping acknowledged that significant deficiencies in senior care have left the majority of seniors unhappy with their lives in modern-day China. Loneliness is rampant and has led to an epidemic of suicides among the elderly who are quite isolated, especially in the country. Economically, the costs associated with dementia will, in the span of 10 years, take China's economic growth rate and put it below that of the United States. In no small measure, dementia in China presents one of the Earth's largest and costliest public health crises.
Robin Williams wasn't just suffering from Parkinson's disease.
He was suffering from another condition, one that was even more serious. Robin Williams was suffering from undiagnosed dementia.
Hello, I'm Hector Elizondo. My mother had Alzheimer's disease. It was heartbreaking. But today there are support services. For now, there is no cure for Alzheimer's disease.
Alzheimer's has been a big part of my family life. Through my grandfather, my uncle, my aunt, my mom, my grandma, and another aunt on my father's side.
As you've heard, unlike any of the other top 10 causes of death in America, there is no way to prevent, cure, or even slow the progression of Alzheimer's disease.
I don't know who I am, and I don't know what I'm going to lose next.
Critics say this is Julianne Moore at her best.
And everything I've worked for in my entire life is going.
In Still Alice, she plays Alice, a wife, mother of 3, and a linguistics professor, who at just 50 years old is diagnosed with early onset Alzheimer's.
A new report today says cases of Alzheimer's disease among seniors are expected to nearly triple by 2050 to nearly 14 million Americans.
We don't know exactly what causes Alzheimer's, but we do know that it is characterized by these abnormal plaques of protein in the brain.
Alzheimer's disease is the most common cause of dementia. As many as 5 million Americans have it, according to the National Institute on Aging.
Across the globe, the population is aging exponentially, and dementia has no cure. Dementia has no treatment, and it is one of the most feared diseases of the new age.
We married in 1940. Then in 1941, Norm enlisted in the Army, The day he went in, they took anybody who was over 6 feet tall and put them in the mule pack. That was really quite a jolt for him.
We are all concerned and focused with Grandma's care as she aged. In the many meetings, consultations, evaluations we had with various medical specialists, there was no diagnosis of dementia. A review of her medical records during her final years confirmed that Grandma had no indication of this disease. With these confirmed results, it's our hope that you will feel better that Grandma did not suffer from dementia. We are requesting that you refrain from using Grandma's name and referencing that she had dementia or any other medical issue in the media. So this is an email that I received from my, a couple of my uncles and aunts back in Wisconsin, where we're going next week, and it's really disheartening to me and other members of my family because I think it really exemplifies that dementia is an extremely stigmatized disorder, and many people without education refuse to face it, and that's to the detriment of people. It's the detriment of my grandmother, and I will not disrespect her memory in my relationship with her by hiding something under the rug. She would want to have this given voice to everybody that needs it, to education to everybody that needs it, and she, I know she would have wanted to have her experience not be in vain. So it's a struggle. I think the struggle goes on, and I'm fortunate to have my mom and all the other people that love me around me to help me through it. So this is why we do it, and this is why we will continue to do it. So I basically helped design a system of brain games, and what those brain games do is they help the person engage in new and novel learning, help them engage in things they've never done before. And people like using these exercises. They're in a structured format that we call the SMART program, and we found a way for Medicare to reimburse for this. So we're taking it here in Phoenix, valley-wide, and looking to expand a little bit beyond that. So looking to get this out to as many people as they can that want it. Our goal is to have people utilize these exercises and stay independent for as long as possible. And it certainly doesn't reverse dementia or cure dementia. We don't have that. What it does is it offers an alternative for people to allow them to maintain a legacy and their dignity and their independence. And those are the things that I have found are the most interesting and most motivating factors to people as they age.
3, 2, 6, 3, 2,
6,
5.
3,
6, 3,
2, 5.
5.
I'm
not going to be able to get
That's okay, we'll do what we can. What were the first 3 numbers?
Brain You Online is the online program that we have developed to help minimize dementia. It's about keeping the brain from, you know, preparing the brain so in order for it to diminish or minimize the effects of dementia. Well, we've noticed that the exercises themselves help. Not only the results that you ensure, for example, somebody's getting a faster time completing the exercises or they get more points, but just the mere taking the exercises, being able to go through the exercises, that in itself improves the brain.
I really never thought about it of being anything else, I just can't remember. Just my memory. So when you have that to happen to you quite a few times, it kind of worries you. You think, gee, how come I can't think of that word? Or, you know, you can remember way back, but right now, you know, is something else, words or something, you know, and I wouldn't want to have to lose my memory and not know where I'm going or what I'm doing. I hope that I would like to keep that from happening so that I can keep independent, or at least have, I might have to have some help, but I wouldn't want to have that much help with my memory, you know.
We've seen a lot of increase in dementias and a lot of folks where they're having more memory issues, and just the idea and the research and what he's done with the program seemed like a really good fit, especially with the way that they can train the brain and teach the brain and possibly keep this at bay. I think it's amazing for the folks that have dementia. And when John first came to me about it, to me it was like, all right, this is a no-brainer that we introduce this to our communities, because we have independent assisted memory care communities, we have skilled nursing, we have our hospice, and we have home health. So our independent and assisted living residents, as long as they go through the testing and can do the class, why not have that extra little bit of training that helps them?
So when people come into the clinics, these are usually people that are at the beginning stages of a dementia process. We have speech and language therapists and occupational therapists that meet with them on a one-on-one basis. They administer something called the Smart Memory Program, which is a system of paper and pencil cognitive exercises and occupational exercises that people can do on a one-on-one basis. And so the socialization aspect of this, plus the exercise aspect of this, really is helpful in helping stimulate the release of chemicals in their brain, which then can help mitigate the decline they're experiencing. We aim to address the three primary factors that older people value the most, which is being as independent as possible for as long as possible. My grandma always said, I don't want to be a burden to me or my family. Dignity and time. We can unfortunately say that we can cure the disease, but we can give people quality time. And at people's end of life stage, I don't think people want quantity time. I think what they want is quality time.
When he was overseas, Norm went to Burma. During the time Norm was in Burma, Dick was born. I sent a notice about his birth. It took him 2 months to get any word of Dick's birth. It was a tough time.
Dementia is one of the nation's largest healthcare problems, with one person being diagnosed every minute. Over 6 million people have confirmed diagnosis of dementia in the United States alone.
John is one of the most determined and passionate people that I know. I've heard him give his speech or his talk, you know, to groups of 5 all the way up to like hundreds of people, this talk about dementia. And he really believes that it's an idea that people just don't know enough about. And he's determined to tell every single person what the struggle is, and that there is actually something you can do. So there'll be so many nights where we're sitting there on the couch and I see him typing up a presentation, and the first slide that always comes up is of his grandma. His grandma was just incredibly important to him. She helped raise him. I never met her, but John talks about her all the time.
It's wonderful. He's a young dude with a lot of passion. And I used to tell John, I was like, you got incredible talent, man. How many people do you know that can equally be a scientist or a doctor and at the same time a very good tennis player? You know, or be able to laugh a lot and have a good time and be playful and creative and have a poetic heart and care about people to that extent, because sometimes science and the medical field become like robots or money machines, you know, in our society.
I would say that it's almost like he thinks he can do everything in a very tight period of time. He's gotten a lot better. I mean, I was surprised because when myself and at the time my wife went to visit John in Montana, when he was at the University of Montana, I remember I got there and I remarked to him, I said, John, you're so organized. And he was living like a bohemian, but the point was He said, well, Dad, you're on my turf now. I'm organized, I have to be. And then the journey began.
Yeah, you know, every time before I speak, I try to just get calm, think about the message that I want to portray to people. You know, just kind of say a quick prayer and tell myself that this is something that this is a real mission and a real opportunity. So just being able to speak at a TED event. One of the main things that I love to do is to talk to younger people about a disease that affects older people. Because younger people can be the main catalyst for changing this disease. But most importantly, when you walk out of these TED Talks today, what I want you to remember is one simple but very, very powerful idea of something that you can do to help prevent and intervene in this disease. That you can take that memory of that person that you hold incredibly dear to you, and you can say, that does not have to happen to my loved one or to me. So dementia is a natural part of aging. This is something we take as fact, and that is not true. 2, there is no way that you can prevent dementia. That's untrue. And the biggest myth among them all is that simply keeping your brain active will help prevent dementia, and that is definitely not true. It kills us before we die. That's your number one fear. If I could be Sigmund Freud for a second, I think that's your number one fear. Of being a burden to your family, of losing your independence, of losing your time, and being dead before you physically die. This should not happen. I want you to imagine that loved one that you had, that person that you had in your mind. I want you to imagine joining hands with them, bridging that gap with them, helping them through conversation, through reduced stigma, to reduce this disease through new and novel learning.
After John's talk, I really kind of opened up my eyes to his talking about the acceleration of the disease, the gravity of how important it is to our society, and how quickly that this is going to become more important, especially with our aging. And as a millennial, it's really hard to kind of conceptualize that and think about that.
I was a caregiver at a nursing home, so I dealt with a lot of patients who had dementia and Alzheimer's, so I kind of related on what he was saying.
My grandmother dealing with dementia and Alzheimer's, and honestly, I had no idea how to handle the situation from his perspective of how to treat and how to not fear and implement new things to the dementia patient. It was just much needed. And I know a lot of times I get discouraged because I feel like I can do more just helping my grandmother. But honestly, the help is within us, and he put that out of me, and now it's just a new journey, and I see the whole sickness of dementia disease a totally new route.
I like the speech a lot. It was very informational and impactful for me because of how my grandpa was. He had dementia, and to learn more that he could have gotten help and that it's something that's preventable was very impactful for me. It's something I can do for my family.
I think if some people are able to get something that they can do, they're able to take something they can do with them, then that's like the biggest thing, the biggest message to me. So I really feel like I have a deep spiritual connection to this, because if I'm able to just go up in front of people and it just kind of comes out, that's like the best possible thing. So yeah, just really grateful for the experience, and I'm hoping the people that were here today will be able to take this and kind of go forward with it, and anxious to be a part of this in the future and try to get to more TED Talks and do more TED Talks in this area. It feels amazing. I mean, the fact that we always love coming back here because it is home for both of us, and it always feels really simple and easy. Like, it's just easy getting around. Yeah, so that's the church. Yeah, no, it feels awesome. It's just an amazing town. I was born in that hospital. Everything is here. I mean, everything is right in the same area. Really emotional time back here in Waukesha. Beautiful day. Really honored to speak at this facility. The best thing about it is that we'll be able to speak about my grandma having lived here and my special relationship with her. So one of the biggest things that I really am honored about today is just having all these friends and family around me. And although I do a ton of these talks, it's great to be able to do this one today. God, I offer myself to Thee, to build with me and do with me what Thou wilt. Relieve me of the bondage of self, that I may better do Thy will. Take away my difficulties, set victory over them, may bear witness to those that would help of Thy power, Thy love, and Thy way of life. May I do Thy will always. Amen. And I just wanted to thank you so much for being here today. I'm going to be a little bit more disjointed than usual today. Just it's an emotional day for me and my mom and our family. So my goal has been for the last 10 to 15 years is develop new and novel learning techniques to release certain neurotransmitters in the brain to decrease the idea of the brain atrophying at an accelerated rate. So basically decreasing dementia. We wanted to give back to this community that has given so much to our family and my grandmother. This would be something for Carroll University to consider in terms of addressing on an interdisciplinary manner what people have referred to for the last 5 or 6 years is the silver tsunami, which essentially means the tripling of our dementia population within the next 10 years. I strongly believe that this represents one of our world's greatest healthcare issues, and that whether we choose to engage in this or not, we will be confronted with it in any field of study that we engage in.
We're here just to kind of be introduced more to a dementia population and figure out how we can collaborate. I think occupational therapy is a great program to go into for dementia. Just overall, we like to improve a patient's quality of life and their social engagement, which is really problematic in dementia. People tend to isolate themselves, and that can further inhibit their quality of life. So getting occupational therapy in there to help engagement and just overall participation is one thing that's very simple to do and is extremely beneficial.
The biggest thing I think I see with patients who have dementia is there's a big push to live in the home right now, and with dementia it becomes increasingly difficult to stay at home. So one push that we would like to see as occupational therapists is for these people to age in place, in their home, where they're comfortable. And a good thing about that is it's super familiar to them. Moving them into a facility that's very unfamiliar is something that can decrease sort of their ability to recognize things that are going on. So that's already a huge issue, and then putting them in an unfamiliar environment just makes that worse.
We need to start taking real firm legislative action to address this as a community and as a larger society. So the president of all countries needs to understand and have a dementia plan in place, not just something that's lip service, but something that's really enacted. We put money into preventing people from having heart attacks. And that's the same thing I'd like to see for dementia. Now, hopefully that's the same thing that will happen in our movement, because what people will see, whether it's now or when it gets on their doorstep, they will see that the #1 problem in this world next to climate change is dementia.
I can still remember, here I am, it's 39 years later practically, and He's giving a presentation back in Waukesha. When you think that you couldn't be more proud of your kids, then something like this happens. I mean, I'm literally a prime candidate. I'm 68. Am I taking the course? Yeah, I just started it. I mean, I found that when I started taking the course, it actually became very stimulating. In fact, I called John and I said, "You're not going to believe this, but I said, I feel like I've just exercised my brain." And I said, my head, my brain feels different.
Do you ever think about getting dementia, Alzheimer's dementia? Are you scared of that at all?
I'm 99 years old. I was born in 1917 in French Lick, Indiana. I don't think I'll live long enough to get dementia. I'm fairly healthy, you know, but I just don't think that I'm going that fast. I'm forgetting some names in some places from way back. As I said, my brain got so full I had to push stuff out one ear to put more in the other ear.
I don't really want to have it, you know, but it does, in a way. Yeah, I'd rather not have to go through that. If I'm going to go, and I know I am, sure, I'd rather not have my mind yet.
I've known a couple of people who had it. I see a couple of people here who have it. In my family, there was nothing like that. Most of my grandparents lived into their 90s and were very alert, lived alone, took care of their own business, and so I feel blessed in that way.
Yes, because my wife died of that.
Joan was in 5th grade. She became very ill. She had a ruptured appendix. She had to have surgery finally. She was in the hospital for quite a while. She came home after a month or two. Those days they didn't have the medications they have now, so she was very, very lucky to live.
This journey is very important to me. This is the Avalon Square. Hi. Hello. In Waukesha, Wisconsin. My mother lived here, my mother Jean Sealing lived here for 12 years. And as we're walking along the hallway, I remember walking with my mother many times when I came to visit. So right around the corner is the elevator. And actually this area, we used to sit here a lot and do crossword puzzles and read the newspaper and then look out over Waukesha, because when my mother grew up, a lot of these buildings, of course, were not here, or a lot of these buildings had different names. A lot of these is, you know, refurbished buildings now. And here we go. It's very touching. When I was coming on the plane last night from Phoenix, I could feel it already. So now this is the apartment we're going to. And when my mother was here, she always had beautiful floral things. I can even see right here a hole in the wall where she used to have different ornaments or decorations for different seasons of the year. 271 was her room. And for me, just to touch this is very meaningful, because many times I touch this or had the key and opened the key. And just to know that, you know, this is a place where my mother spent 10 years. And I loved coming to visit her. A lot of happy times there. A lot of happy times. My mother, then in about the 10th year living here, took a couple of falls and really was hurt. So that's when we had to change and go to assisted living.
This is the church that it all began for me. I was baptized here, First Presbyterian Church in Waukesha. Great city. It's, you know, it's small, so everything's simple. It just feels amazingly peaceful to be back here. Amazing place, awesome people here, and, you know, just down the street from Avalon. So, really awesome place, and very, very grateful. Thank God that I'm here. Nothing feels more to me like that than the actual church and being here at church. And now that I've really found God and spirituality again, it's like being back in church for the first time. And First Church is just definitely like that for me. It's amazing how an art class, I feel like, has been as beneficial to me as just this very specific niche of neuropsychology that I've been into. I think it's just this idea of imagination and creativity, right? Because one of the things I think that I've been really fortunate in all my training is that it's just, I feel like as I revisit my teachers, I've had a lot of great opportunities along the way of people that have encouraged imagination and innovation. So, you know, what I don't think I ever could have done what I'm doing now without that innovation piece, that encouragement of innovation.
Yeah.
And art's a big part of that. I mean, I think maybe I've been attracted to teachers or just really glommed onto those concepts, because it's never really fit me until now in terms of doing what I do. People are always saying, you know, how does this help me? Like, how does that drawing and painting class in high school, or how does that class, you know, that I took in calculus or whatever, how does that all help me? And it really feels like, at least maybe other people don't experience this, but for me, all of it has kind of come into this, like all of it, which is pretty unbelievable. Like, it's like, yeah, that all helped me. All the stuff I did.
Bingo.
This experience.
Exactly.
Yeah.
And that's the view that has to be held, because nothing is siloed.
Yeah.
Everything's interconnected. If you take that viewpoint,
yeah,
it all contributes. It's like people in your life, they put tools on your table until you find out later on what they're for.
Right.
And watching you guys do that, you know, figuring things out visually.
Yeah.
You know, it's not easy, but it's, you know, when you get it,
yeah,
it's fun.
I think that we lost our grandmother, but I think more importantly, we all lost her before she died. And I think that's the key to really think about for me and for other people, is that we lose people before they actually die. And there's just no reason for it. So I didn't want to lose my grandma before she died. I didn't want her to be confused and in distress and to be not herself. And I wanted her to age gracefully and have that independence. And so that's the big piece for me, is that we lost her. Thank God we didn't lose her for many years. It was 2 years probably, but we lost her before she died. The reality is that we all are dementia. We all are dementia. We all are this disease. You are dementia. You're not unique in comparison to anybody else. So when you think about what dementia really is, we think about it as it's somebody else. It's the person that we think about, but it's us. It's us as a person with potentially dementia. So I don't think of myself as any different than anybody else. My grandma wasn't different from anybody else. So what I really hope that people remember is that they are dementia, for good and for bad. And I think we can make it less bad. We can make it more good. Can't make it perfect, but we can make it more good. This has been a long journey and taken almost everything from me. Being on this journey to find the answer to the problem of dementia is like trying to solve a question within myself. This is a mission from God.
All I can say is that it's been a happy life and a blessed life. I love you all so much.
Bring back my Bonnie to me, to me. Bring back my Bonnie to me.
Dementia and Alzheimer's disease is very real and very frightening for those affected and their families. Here are a few pieces of advice to keeping your brain healthy and delaying the onset of this disease. First is nutrition. Heart health equals brain health, so a healthy diet will keep your brain strong. Second, keep your brain healthy by doing new and novel activities. New and novel activities release a chemical in the brain that in turn prevents the brain from shrinking at an accelerated rate, helping prevent the onset of dementia. Lastly, keep your mood up and do what makes you happy. Increased happiness will decrease depression, or what is referred to as double dementia, dementia with depression. While there is not yet a known cure for dementia and Alzheimer's disease, a healthy and developing lifestyle is known to aid in prevention and delay acceleration of the disease. At Smart Brain Aging, our journey continues, but yours has just begun. Thank you for watching this documentary and appreciate your consideration for any donation to the Gene Sealing Dementia Prevention Foundation.